Hi, welcome everybody to our latest episode of Medical Videos for Education by VitaCare Family Clinic. My name is Dr. Chen Yiming, Medical Director of VitaCare Family Clinic and founder of Fitivate.com. Today we're going to talk about fever in young children. What are the causes? How do you manage them at home? And when should you bring your child to see the doctor? The content is purely for education. It is not meant to replace an actual consultation with your doctor. And of course, what I've spoken and talked about in the video is not exhaustive. If in doubt or if there's any concern, please speak to your friendly neighborhood family physician. So without further ado, let's begin with the video. Let's go. Okay, hello. Welcome to our next topic, which is fever in children. I believe fever is a very common issue that can present very commonly in children, and it can be as distressing to the parents as much as it is to the child. So today, I hope to be able to tell you more about fever, the causes of fever, and how to deal with fever at home. Fever is defined as a body temperature of more than 37.5 degrees Celsius. We can divide it into a low-grade fever, which is between 37.5 to 38 degrees Celsius. Or it could be a high fever or a high-grade fever when it's more than 38.5 degrees Celsius. What are the common causes of fever in a young child? The most common cause is actually the viral infections. Second common will be bacteria infection. Of course, there are also other less common causes that include autoimmune disorders and malignancy. As a family physician, I often see young children in the clinic, and I divide the causes of fever into 4 big groups. 1. Upper respiratory tract infections. These patients often present with fever and flu symptoms. Cough, runny nose, blocked nose, sore throat. Secondly, gastroenteritis. They present commonly with fever and gastrointestinal symptoms like vomiting, abdominal pain, bloatedness, and diarrhea. The third group would be the fever and rash. There's many causes of the fever and rash in children. Some of the common ones that we do see in our clinic, in the community, would be hand-foot-mouth disease, where this patient presents with multiple mouth ulcers, throat ulcers, red dots on the hands, legs, knees, elbows, and buttocks. There are also measles, which are less commonly seen due to our measles vaccination. We can see chickenpox, dengue virus, Kawasaki disease, all of which can cause fever with rash. The fourth group would be the fever with no obvious signs. Some of the common causes of this include urinary tract infection, abdominal infection, meningitis. This is a group of patients that require further investigations and closer monitoring. So what can you do as a father and a mother at home in helping your kids? I think the key in the initial management is to try to bring the temperature down. And some of the common steps and the easy steps that you can do would be: 1. Keep your child hydrated, right? Do not be too worried about what they are drinking. Of course, plain water would be ideal. You can also give them isotonic drinks like non-gassy 100 plus, H2O, Ribena, Yakult, Vitagen. These are good options as long as they drink, keep them hydrated. Wear loose clothing for them. Do not keep them bundled up too tightly, or do not put on too many layers of clothing, because if it's too hot, the temperature may go even higher. Adequate ventilation. What are the ventilations that you can turn on? 1, of course, the fan. Okay. Secondly, you can turn on the aircon. Keep it at about 25 to 27 degrees Celsius, not too cold. sponging with room temperature water, you can sponge your child for about 10 to 15 minutes. The sponging actually helps to bring away the heat of the body by the evaporation of the water. Definitely, if you have fever medications at home like paracetamol and ibuprofen, you can give it to the patient or your child, provided if he or she has no drug allergy and you are sure of the dosing. So when do you need to bring the child to the doctor? There are a few things that, if it happens, requires you to bring your child to the doctor. 1. Febrile seizure. Febrile seizures are fits that occurs as a result of the fever from an infection. Secondly, if they are drowsy and less responsive than before. Thirdly, persistent vomiting, such that they are unable to drink any water at all, and this may predispose them very quickly to dehydration. 4. If the young child is a very young infant that is less than 6 months old. In this group of patients, must be very careful because the immune system is still not very mature and developed, and they are at risk of developing atypical infections which are not easily treated. 5. Reduced urine output. You can know that they have reduced urine output if you see the urine becoming very, very dark yellow, or the amount of urine that comes out each time is very little. Again, this is an indication that the child is already dehydrated. Breathlessness or wheezing. If this happens, it may indicate a serious or severe airway infection or inflammation or tightening. Please bring your child to the hospital or see the clinic doctor straight away, as they may rapidly deteriorate. Abdominal pain. Any form of abdominal pain in a young child can be very distressing. Not all causes, or rather not all abdominal pain are severe or serious, but it has to be looked at. So what should you do in the event of a febrile seizure? Firstly, I think the key point is to be able to recognize that this is a seizure. So what are the few things that you may see? 1. The child will suddenly become unresponsive. So he or she will no longer respond to your calling. When you try to tap the shoulder or when you try to shake him gently, he is still unresponsive. Most of the time, there may be jerking movements of the hands and legs, but occasionally there is none. There's a special type of seizure called absent seizures, where the child is simply just unconscious. You do not see jerking motions. You can see eyes up rolling sometimes, not all the time. There may be uncontrolled urination or passing motion during the seizure. Again, not all the time. So once you recognize that this is a seizure, place your child in a safe environment. If he or she is actually sitting on a chair, slumped onto the table, please carry them down, put him or her on the floor. Okay? Remove all dangerous objects around them. For example, any hot water, any heavy objects that may fall onto them, please remove all this. Lie them on the side so that any saliva or vomitus can come out from the side of the mouth rather than backwards into the lungs. Please keep track of the duration of the seizure. Okay, it is important. And please call 995 to activate the ambulance if the seizure is more than 5 minutes, or if the child developed 2 or more seizures consecutively. Right? So we have come to the end of the talk. I hope that it was informative and you have learned enough for you to be confident in dealing with fever in a young child. Okay, remember, do not panic. Be confident, and if you have any concerns or doubt, please see your family doctor or bring the child to the A&E so that everything can be sorted out. Okay? Thank you for listening. Thank you for watching. We'll see you again. That's it for this episode of Medical Videos by VitaCare Family Clinic. I hope you learned something from this. If you like our videos, please click the subscribe button to receive updates on new videos. Please also check out the rest of our productions. If you have any topics you would like us to talk about, reach out to us via Facebook, WhatsApp, or website. Thank you. Till the next time.